In India, you don't get Chinese food without MSG. We had one gentleman, he said, Suman, for lunch and dinner, 4 meals I had Chinese and he had a stroke.
Someone who is suffering with PCOS and maybe a bit overwhelmed, what is the smallest thing that they can do that can help?
Diet smartly. I have seen a lot of PCOS girls coming to me and having too much.
Wow. In India, it's about 10% of the population. What is the most common mistake that you see people with diabetes?
Diabetics are always at the risk of losing muscle. So they need to do weight training, no matter they are heavier or lower. Like intermittent fasting can also give you acidity, can also cause muscle loss. Third issue is your...
So another condition which is very prevalent in India is high blood pressure. What can be done in these situations?
So high blood pressure is very...
I would like to understand from you, what is the biggest misconception that you see out there that drives you nuts?
Yeah. So this whole IF thing, like intermittent fasting, that you have to eat by 5 o'clock, 6 o'clock, and then don't eat anything till maybe 10 o'clock next day. That's 16 hours, right? So 10 o'clock next day. So this drives me crazy.
Why?
Because I feel that you are living in a city.
Yeah.
The sunset does not, like, you know, in Bombay, people don't sleep early. Everyone's almost sleep time is around between 10 to 11. And so starving your body for 16 hours can have its own side effects, especially if you are menopausal. So I forgot to mention menopause.
Menopause.
So it's a huge group of ladies who come to me who are all menopausal. So how to alleviate their issues is what we fight.
Which also in India starts earlier than in the other countries, as what I understood.
Yes. So, so I understand that if you are above the age of 40, 45 and if you do IF, of course it gives you good results in terms of weight loss and everything, but can also give you acidity, can also cause muscle loss. So like muscle loss which will never be recovered back, because you know it's very difficult to build muscle after the age of 40, 45. You really have to work harder as compared to when you're younger. So that is the second issue. Third issue is your immunity. Your immunity takes a big hit if you're doing IF. And you know, Bombay's climate or the weather is highly polluted. The air is highly polluted. So you are more at the risk of falling sick if you do IF. So like frequent cold and cough or like flu, etc. will be, you might face more of that. So we don't believe in 16-hour fasting.
Okay.
We believe in that one should eat. So best is 12-hour fasting, maybe till the age of, because you know the children growing years and even for till they are 35 or like adults. So in their prime of their age, they cannot afford to lose muscle and have bad immunity.
I see.
So we recommend that nobody should do IF. Okay, 12 hours fasting is great. And as you if you want to do fasting like that, maximum one should step it up to 14 hours. So between 12 to 14 hours, you should play for your fasting.
Okay, so
that really drives me nuts when people come and they have so many issues.
Okay.
And another thing which drives me nuts.
Okay, now I see that. Let it out.
When they have fruits empty stomach.
Oh yeah.
Yeah, that's a very big no-no.
Yeah, because it spikes the sugar level, right?
So good.
Yeah, I've been thinking about that because I used to do that, so that's why. And then I learned not to.
So you can be slim. Because you are doing fruits empty stomach. Besides raising your sugar levels, another thing happens, which is if you are prone to diabetes, there is a chance you'll become diabetic earlier than later.
Oh, okay.
If it is in a genetic history. Third problem. Your gut becomes really weak.
Why?
Because you know fruits. There's no fat and there's no protein. It's more water and sugar. And of course, there's a lot of fiber and vitamins. So it because its digestibility is 30 to 40 minutes, so it passes through your digestive tract very fast.
Yeah.
As compared to solid food, which takes
Yeah.
around 8 to 10 hours.
Yeah.
Or the non-veg, which takes longer. So when it passes through the digestive tract so fast, and first thing in the morning, there is no other food coming in. That means, of course, you feel very clean and you feel very energetic. You have very good motion. You don't have constipation. All that happens. Yeah. But at the same time, the good bacteria also get washed out.
Okay.
Your digestibility of heavier pulses
Yeah.
or proteins which are tougher to digest, or chicken or fish or curd or cheese, you will not
Yeah.
be able to digest.
I see. I
Yeah.
see.
So
Okay.
digestibility, second is progression towards diabetes, third is sugar spike. These are the three issues.
Okay. Anything else that you need to come out of?
Yeah. And also, because of that,
I knew there was something else there.
and also their absorption of vital vitamins goes down.
I
So
see.
for example, iron and B12 absorption from your gut becomes so weak.
Okay.
And one more thing really irritates me.
Yes. Go ahead.
The whole India is only cooking in ghee, which is saturated
Yeah,
fats.
yeah, yeah.
Yes. A lot of people in India think that they should only cook in ghee, which
Yeah.
is that Indian butter.
Yeah.
Not oil. So that is causing a lot of issues in a lot of people. So that also
Okay. Wow. Okay, but we put it out there, three very, very important ones. So intermittent fasting, right?
Having
foods in an empty stomach. And the third one is
cooking your meals only in ghee.
in ghee, yeah.
So earlier I used to fight everyone in India or abroad or wherever were only cooking in olive oil.
Yeah.
Okay, and Indian cooking cannot be done in olive oil because we need very high temperatures because we tamper our food.
Yeah.
So now it is the other stream. So MUFA to straight away SFA.
Okay.
And
okay.
PUFA, which has essential fatty acids, goes missing from their diet, especially if they are vegetarian, which can cause have its own repercussion. So not having any oil fat, which is PUFA, which is polyunsaturated fatty acid, which has essential fatty acids. Why is it essential? Because your body needs it and you have to get it from the food. Like people in Europe, they have fish, a lot of fish. Fish has PUFA.
Yeah.
But if you are vegetarians, how do you get PUFA?
Okay.
So that can cause deficiencies, skin issues. There are hormonal issues, for example, PCOS. Then also immunity-related diseases can hit you faster, which is, and third but not the least is autoimmune diseases, which is rheumatoid arthritis and such can really trouble you.
Yeah. Okay, so you talk about PCOS. I think let's go into PCOS. I see some studies, they say like in India, it's between 10% to 25% of women, they have PCOS. And I had more conversations about it. It's like a silent disease. So people say it's about the hormones. Is there something that contributes for PCOS which is related to food?
Yeah, so it is not just food related. PCOS is also genetic.
Yes.
And also it is lifestyle related.
Okay.
And also it is lifestyle in the sense how sedentary you are.
Okay.
Yeah. It is more prevalent in places where the girls or the women are really leading a sedentary life, not doing much exercise or training, etc.
Oh.
And also the choices of food, which is like too much packaged food, or in terms of not the protein, carb and fiber balance, and the fat balance, which can cause, like I said, PUFA has to be taken, too much junk food intake. And then there are hormones which are off, which can be the 2-3 hormones which I've seen mostly being off for PCOS is insulin, which is produced high, so it gives them hirsutism. And then, of course, they have darkening of the neck and underarms, etc., which is another skin issues, acanthosis nigricans. Then we have, that is the insulin related. Then they also, another hormone which goes off is thyroid.
Wow.
Yeah. So it is on the higher side.
Yeah.
Then another hormone is prolactin, which all these hormones elevated will make you gain weight. Once the weight goes up, then it is more difficult for PCOS to get corrected. Yeah.
Wow.
Yeah. So we do handle a lot of PCOS where, and of course, lifestyle does not only mean exercise, also the sleep pattern.
Also
So,
impacts the
yeah,
PCOS.
sleep, yeah. So it is the whole lifestyle, the choice of food, the sleep, the amount of exercise they do,
Yeah.
and the stress. So
But how much do you think it's related with genetics?
genetic play a very important part.
Okay.
Yeah. I think 30 to 40%.
Okay, yeah. So 31st, but then the rest, it's all
Is,
what you're saying.
lifestyle,
And
exercise,
exercise, yeah. So do you have an example of someone that came to you and with PCOS and felt like this is impossible, I've been suffering for many years, and you were able to reverse it through food?
Yeah. So we had this lady coming in Kolkata clinic.
Yeah.
Her name is Pranayama. So when she joined us, she was around 87 kgs. She
Wow.
said that I want to do it naturally. I
Yeah.
only want to do it through food, lifestyle changes, exercise, and nutraceuticals. So, she lost almost 28 plus kgs. Yeah. And yeah.
When you talk about this, like 40, 28 kgs, it's
Yes,
unbelievable.
amazing. She
Yeah.
did really well.
And
We
then?
have cases where people have lost 50 kgs too.
Wow.
Yeah.
Okay.
So she lost weight, and her even the cholesterol goes up for PCOS. So that came within the normal range. Her triglycerides dropped, her total cholesterol dropped, her LDL dropped, and her thyroid levels, which were borderline high, around a +5 TSH, it came to 2.45 normal range, and every hormone came to normal after she dropped weight. And of course, she was put on nutraceuticals, which we checked her B12, D3 iron. We made sure it is optimum. Then we gave her a good exercise plan, and we gave her a very good diet. So she was from Kolkata. She loved fish, so we added fish generously in her diet, eggs also, and pulses also. The best part about that, actually, she was the star here because she followed it really, really well. And she became her ideal body weight.
Wow, what a
And
story.
it got
yeah.
reversed. Her periods now come on time. She doesn't have aches and pains, and yeah.
Okay, wow. So that is for PCOS.
Yeah. So we have many, many, many cases like her.
Okay, and it's possible to reverse through food, as you said.
She didn't take a single medication. We gave her D-chiromyoinositol and myoinositol, which are the sort of nutraceutical which can help them to balance their nutrition. And then we gave her vitamin C and ubiquinol, which is the active form of coenzyme Q10. Then we gave her multivitamin and checked her D3. Sometimes very low D3 is directly linked to very high levels of insulin, and very low iron levels is directly linked to high levels of TSH, thyroid levels. So we balance all that.
Okay. Well, okay. So PCOS is possible to reverse through food. Now, maybe I would like to talk about diabetes. In India, it's about 10% of the population.
Oh my God! Really?
It's like
Diabetic capital of the world.
Yeah, so 1 out of 10 have a diabetes. Like for diabetes, what is the most common mistake that you see people with diabetes do with food?
Because they think desserts are their enemy.
Yeah.
So they think it's okay to have fruits. They have lots and lots of fruits, which is fructose, which is sugar.
Yes. Wow.
Yeah. So any diabetic comes to us. So we have a we tell them, I'll tell you what you have to avoid. You don't have to avoid everything.
Yeah.
And also another thing I find in diabetes, okay, I can't have sugar, but of course I can have jaggery, and I can have honey, and I can have dates, and I can have date syrup, and I said, all that is sugar.
It's sugar.
Ultimately, it's going to convert into glucose.
Exactly.
Of course, honey has its own benefits, date syrup has its own benefit, and jaggery has some more iron, but they all ultimately are sugars, will spike your sugar. So this is what I tell every diabetic. So if you want to take any of these, 2 teaspoons is okay.
Yeah.
So what they do is they don't have sugar in their tea coffee, but they'll definitely have a dessert in a day.
Okay.
Either it's frozen dessert or chocolates or pastries or mithai. And another problem is they all think papaya is okay. It's diabetic friendly. Everyone. So I tell them there are only 10 fruits which you can have. And there are 2 grains you should not have in anything, which is corn.
Okay.
Yeah? Corn in any form, like corn flakes.
Yeah.
Boiled corn. Popcorn.
Yeah.
Corn flour. And in India we get makke ka atta.
Okay.
Even that.
Okay.
So everything to do with corn can actually raise their sugar levels.
Okay.
Everything to do with rice can raise their sugar levels. We have seen that time and again. So white rice, poha, which is like beaten rice, then kurmura, which is like puffed rice. Then we have South Indian food, which is made primarily with rice and little pulses. So that also raises sugar level, like dosa or idli, traditional ways, and uttapam. So these really raise your sugar levels. So we tell them to avoid 2 grains, which is rice, which is white, and which is corn in every form. But of course, there are certain rice one can have and may not shoot your sugar levels, which is red rice or brown rice.
Oh.
They have more fiber.
Okay.
So they have to check which rice suits them better for their sugar levels. And of course, with CGMS, which is continuous glucose monitoring device, you can check your sugars and understand which grain works better for you. Then again, people think wheat isn't your enemy if you have diabetes. Everyone comes with no wheat in their diet. I tell them, all your life you have eaten wheat.
Yeah.
It's okay if you, like one lady came to me, she's been diabetic since years.
Yeah.
Of course, she got into this. She has come to us. We managed her sugar levels very well. She's from Delhi. So she said, I have been having no wheat in my diet. So she said, I heard from someone and I started following this pattern of no wheat. And I said, okay. I said, do your whatever you want to do. I'll have millets, etc. Then she calls me from USA and she tells me, Suman, what you gave me was the best because I was happy and at the same time I had no aches and pains. Because she gave up wheat and she started having millets and other form of grains, she said I started having aches in my body. That was, of course, an individual case. So as soon as she had that one chapati, because we all have grown up eating chapatis, right? She said all her pains and aches disappeared.
Really?
Yeah.
Wow.
So we tell diabetics, wheat is not your enemy, but the quality of wheat is a problem what we get in India.
Oh, I see.
Because of the over usage of pesticides on our soil. So the wheat quality may not be as good it was 25 to 30 years ago. So that will take its own sweet time for the soil layer to change. But that should not be reason for you to give up wheat. So that is one thing I tell them, that it's okay to have wheat. Okay. You can, of course, try the diabetic friendly millets and grains, which is kodo millet. So like 3 grains which are there are certain grains a diabetic can have which is specially good for them because they have more fiber and more protein, and as compared to wheat, which is foxtail millet, then kodo millet, and then amaranth. So, but it's not that they only have to eat that.
Yeah.
They can have little, again, the key is balance. The amount of carbs they have. And they should not have fruits empty stomach, as you know.
Yeah.
The fruit should come after a meal as a dessert, so they don't crave for dessert. That's what you do for diabetics. And of course, they have to keep their vitamin D primed because low vitamin D raises their HbA1c. And they have to exercise. Diabetics are always at the risk of losing muscle. Yeah. So they need to do weight training, no matter they are heavier or lower. Weight training is the key for them to maintain their sugar levels, because more muscle you have, more capacity for you to burn glucose. Yeah.
You mentioned
And every diabetic in India comes to me, most of them. We are walking, we are exercising. Walking is not the only thing.
Okay. So you need to increase the exercise.
Yes.
Yeah. You mentioned there are 10 fruits that they shouldn't have.
So apple and pear have soluble fiber. They are one of the best.
Okay.
Yeah. Then we have pomegranate.
Okay.
Then we have guava.
Okay.
Then we have oranges.
Yeah.
Then we have dragon fruit. Then strawberries, berries, of any kind. Then kala jamun, which is a very favorite of all Indians. Then we have pomelo, but not the Thailand one. They are really sweet. Indian pomelo, which is little sour in taste, is very healthy. So these are some fruits they can have, which does not spike up their sugar levels, but everything else does.
Oh, okay, cool. We are clear about that. Maybe any story that you had with someone with diabetes that came to you and was able to reverse completely diabetes only through food?
I'll tell you two studies here. So one, I will say someone who came with, of course, many come with taking insulin, and we have many case studies where they have stopped taking insulin. And we have many case studies where they have reduced the insulin to less than half. Okay, let's talk about someone who's completely stopped insulin. So there is this gentleman who was around 49 years old. He came to us in 2019, and his name is Dharmal Podani. He was taking 70 units of insulin. Okay, of course, I just removed the paraphernalia from his diet, which is desserts and frozen desserts and ice cream and chocolates and fried and papad. Then I said, okay, now let's focus on good food. He said, I have to have paneer every breakfast because he doesn't like eggs. I said, I'm happy to give you paneer. And so every morning he had paneer and parathe. No parathe, it's like thick Indian roti made with ghee or oil, whatever. So he had paneer and parathe every morning.
Yeah.
And then his lunch was either chapati, dal, sabji and little yogurt, or he used to have butter chicken and chapati and vegetables. Then his evening snacks had some carbs, and then his dinner was again same as lunch. So that is how we planned his diet, and of course we balanced his protein, and we initially gave him more of cardio because I didn't want him to crave for or too much exercise would really fluctuate his sugar levels and we wouldn't be able to manage because he was taking insulin. We didn't want him to go into hypoglycemia in the night especially. So we controlled his exercise, we controlled his meals, and then the magic started because he followed it to the T. He started reducing his dosage of insulin, and in 6 months his insulin from 70 units came to 0, which was amazing.
In 6 months?
6 months. He started his weight from 100 something plus, and in 1 year's time his weight came down by 25 kilos.
Wow.
More than 25 kgs actually. Yeah. So that was his weight status and insulin status. He was on some oral medication. So his doctor was from America. He added some bit of oral medication in terms of Jalra and maintained his metformin. And and now he does weight training and he does all form of exercises, maintains his muscle mass, increases his muscle mass, and till now he's same around between 81 to 84 kgs and he's doing great.
Wow. And I think what you're saying, you keep repeating that these people that were able to reverse, they were very disciplined, right? They followed everything that you said and they were very disciplined. So whenever you are in that journey...
Yes, they were reporting daily.
Yeah, but so you need to, the thing that I'm seeing is that you need to have a really self-discipline. Yes. So this is what I have to do and I follow and I don't deviate, I follow, and then that's where the results happen because it's amazing. In 6 months, you're able to reverse that. And there's people that they have that for an entire life.
And he had wheat and he had butter chicken.
Yeah.
He had normal food.
Wow. Wow.
I never removed anything except desserts and alcohol. So there was another lady who came to us. Her name is Kalpana Gokal, and I've never seen anyone with such high levels of HbA1c. So me and Dr. Anand got onto the case, and can you believe that within 4 to 5 months?
I believe you now.
Oh my God. So, she was, of course, on medication for lowering her cholesterol, and also for, she was not taking insulin, she was taking oral medication for diabetes. So, from 13.6, it came to 6.9 in 4 months. It was huge.
It's huge.
And I was like praying to God, thank you so much for, like, she literally, she was not in a good space. At 13.9 was bad. And but of course she was dedicated. It's not that we omitted carbs from her diet, we reduced carbs. We understood she was a big frame person. Her frame size was really big. Her ideal body weight was 65. So in almost 4 to 5 months, from 90 plus kilos, she came to 82. So almost 14-15 kg she lost in this much time. And we didn't want a quick weight loss for her, because we didn't want her to lose any muscle. We wanted her only to lose fat. So and her ideal body weight was 65 to 70.
Wow.
So we had to give her a good
Yeah.
amount of protein,
Yeah.
which she was missing in her diet. So she was trying to eat lesser and not balancing her meals. Her activities were not so much. So we put her on training and cardio, and gave her, we had to give her some artificial protein powders in terms of whey protein, so that she doesn't drop muscle. When she came to us, she was 58 years old. So we didn't want her to have sarcopenia or any side effects. In fact, we wanted her to build muscle. So I think this whole, with Dr. Anand and me and counseling, everything worked wonderfully. And I'm so happy she's still with us. She's taken maintenance where we meet her once a month.
These stories are so inspiring.
Yes,
Yeah,
yes.
I think, of course, you did an amazing job of all the 360, but also the willingness that people need to have to do that.
Yes. A lot of counseling goes.
Exactly, yeah. But the most important thing of this conversation, that it's possible.
Yeah, it's possible through diet.
Exactly.
And now this Kalpana is at 74 kilos.
Oh,
So altogether she lost 20 plus kilos.
that's a lot. Yeah.
Yes. So yeah, reaching your ideal body weight also reverses your ailments. Whether it's blood pressure or
Yeah.
ischemic heart disease or diabetes or knee pain or back pain, everything gets reversed. So it's like juggling between many issues and coming to, okay, this is the right solution.
Nice. Okay, so now we understood the PCOS cases where it's possible to reverse. Diabetes, you blew my mind with your cases. So another condition which is very prevalent in India is high blood pressure.
Yes.
What can be done in these situations?
So high blood pressure is very tricky. It's like if you have pressure, one has to take medication, because blood pressure if you have high pressure and you are not taking medication, you are literally sitting on a bomb. Yeah. So
Yeah.
what we tell everyone, if you have pressure, take medication.
Yeah.
First rule. Secondly, then we check their vitamin D levels.
Yeah.
So blood pressure goes off in your body because of many reasons. One of them is low vitamin D, which does not allow calcium to be absorbed in your blood.
Oh.
So, and calcium is what keeps your pressure in a good range.
Oh, yeah?
Yes.
Oh,
Calcium and
interesting.
magnesium,
Yeah, okay.
So we check the vitamin D,
Yeah.
make it optimum. Then we introduce some amount of milk protein in terms of yogurt, which is non-salted, unsalted yogurt, and not cheese, because cheese has too much of salt. So yogurt or paneer or milk, whatever they can digest. So which has why we give this protein especially to people with blood pressure is because the calcium in milk protein is of a highly absorbable value. So that helps. So I have this a very, very famous neurosurgeon of the world. So Professor Majid Sami. So he asked me once that, Suman, I want to do surgeries till the time I live. So he was around 74 years old. Okay. And he had blood pressure. He was on medication. He said, I don't want my hand to shake, because he was a neurosurgeon.
Wow.
So I checked his diet. Only thing I introduced in his diet is yogurt. And his pressure came down. Yes. And he called me. He's from Germany. He has his own hospital. And he called me. He said that you have really, knew where to hit the nail on the head. That's how we treat people with pressure. We make sure if they don't have lactose intolerance, then we introduce some form of milk protein, especially yogurt, because the calcium in yogurt is higher than it is in milk. Yeah, because of the fermentation. So that is the second thing, the calcium and the D3 plus the exercise. So they cannot do excessively high, too much of training because they can have issues. So we give them cardio like swimming, cycling, cross trainer, and walking, jogging, etc. And lesser amount of weight training, not too much. They have to do training, but not too much. Then we also check their intake of food, which causes pressure to rise, which is fruits like lychees and muskmelon, which is more in salt. Then we have packaged food, which is of course higher in salt. Then we have Chinese food. In India, you don't get Chinese food without MSG.
Oh, yeah.
Monosodium glutamate.
Yeah.
So that tell them not to touch Chinese food. In fact, we had one gentleman coming from Europe. He said, Suman, for lunch and dinner, 4 meals I had Chinese and he had a stroke.
Wow.
Yeah, so I know what Chinese food can do to you because he was prone to blood pressure. So it's not that he had it because of Chinese food, but he was prone to it and he pushed it.
Oh, I see.
At the brink. That's
I
why.
see.
So, so the Chinese food should be controlled. Soya sauce, so you can.
But when you say Chinese food, sorry, it's about all
the soy sauce and MSG.
MSG, exactly.
Yes, soy sauce is very high in sodium. So if you switch to tamari or other sauces which is low in sodium, so you need to read your label.
Yeah.
So that then you know. All the pickles and papads and chutneys in India, very high in salt. So one thing we omit completely from that diet is papad and pickles and chutneys. Yeah. So yeah, these are the changes we make for them. And of course, there is popcorn, boiled corn. They're high in salt. Even cornflakes, though it doesn't have salt, it's high in salt. So if you compare, say, a slice of bread as compared to one chapati, bread might have more than 60, 70 times more sodium than a chapati.
Yeah.
So that's the kind of packaging and all that do to you. So that's one thing we do. We also tell these people to lose weight. So to reduce the pressure on the artery and stop smoking. So weight loss. So we have this case of Mr. Khandelia. He came to us, he of course lost more than 20 kgs and in this journey he stopped his medication. So a standard dialogue goes to anyone who's come with weight loss and having blood pressure. We tell them, please check your pressure every 5 kgs you lose. There is a chance you'll have to stop your medication. And they are surprised because all these medication has some side effect on you. But you cannot do also without medication if you have blood pressure. The best way to handle blood pressure, if you are overweight, lose weight, and avoid the food which I mentioned, exercise daily, sleep well. Sleep is the bottom line of every problem. Now, the one thing which is not known all around the world, but there is one particular type of pranayama which can actually harm you. And
pranayama?
Yeah. So I know that what is recommended for people with pressure is meditation. Meditation is great. And breathing exercise like pranayama is also great. But there is 1 or 2 pranayama which can actually harm the people with blood pressure. Which I have been like talking about it maybe from 2002.
Okay, let's go one more time.
Yeah. So it is called Kapalbhati. Okay. Kapalbhati is when you breathe like this.
Yeah.
So this increases, if you have blood pressure, it can actually damage you.
Okay.
Yeah. So people with blood pressure should think twice before doing this particular kind of breathing exercise. Doing in limited numbers, 10, 15, 20 is okay. But doing like 100, 200, 500 can actually really damage. I mean, can actually increase arteriosclerosis and thickening of the artery, which will increase blood pressure and which will take very long to go down. And the second one is called behestrika, where you blow out air with force like this. So, which is also not good for you. So, our standard dialogue is, if you are doing these two form of what you call breathing exercise or pranayama, stop.
So you help people to reverse disease through food. Maybe what are some of the principles that you use when someone comes to you with a medical condition?
So if anyone comes with, so the kind of medical conditions we handle through diet are, of course, the top of the line is diabetes, blood pressure, cholesterol, which are actually together called metabolic syndrome. Then we have ischemic heart disease, where a person has stent or done where they have stents in their arteries.
Okay.
So we handle their diet. Then, of course, another disease which is related to lifestyle and many other things is cancer.
Yeah.
So we handle that. Then or muscle and joint conditions, which is osteoarthritis and back pain and knee pain and spondylitis. These are related to osteoporosis, all bone conditions. Then we handle sarcopenia, then we handle rheumatoid arthritis. So we have a lot of autoimmune disease which we work very well, which is rheumatoid arthritis and muscular dystrophy. Then we have myasthenia gravis and we have multiple sclerosis. We have all these people coming to us whom we help. And through diet, and so that the disease is progressing, right?
Yeah.
How you can digress the progression of disease. So that's what we do, and giving them, so that is another thing. Then we help people with migraine, PCOS, and pregnancy, lactation. Then these are the lifestyles which we work on, and of course geriatrics. Geriatrics have a complete different diet needs.
Geriatrics like what?
Like the people who are older than 70, 75 years old. Their dietary needs are very different. Their exercise needs are different. So then we have toddlers coming in of every age. So the teenagers come for height growth, and if they have so any conditions, type 1 diabetes, type 2 diabetes, even we have youngsters coming with MODY, which is maturity onset of diabetes of young. So everything under the sun, which can be helped with diet, we help.
So what are the
and gut issues, sorry.
Oh, and gut issues,
is a huge deal.
So what are some of the chronic disease that you are able to reverse, not to improve the quality, but to reverse through foods?
So chronic diabetes,
okay,
and cholesterol levels, blood pressure, migraine, then gut issues, then back pain, knee pain. All these are chronic problems. If we help them and it just goes away. Then hair fall. It's a chronic issue. So hair fall and PCOS, which gets totally reversed. Actually many. These are what I can remember.
I'm speechless. We
have so many case studies for every disease.
And when people come to you, normally they come at which stage?
Every stage. It's like someone who is a PCOS but obese. We have someone who has PCOS but underweight or same weight. We have diabetes where someone is very slim but very high levels of HbA1c. I have a fantastic case study for that. Then we have someone who's 100 plus kilos and high levels of diabetes on insulin.
I see.
Those kind of cases. Then people who come with blood pressure. Of course, blood pressure is also related to obesity. So and reduction in your cholesterol levels, so the arteries have lesser pressure. So weight loss and blood pressure sometimes go hand in hand, and we have seen people stopping medication.
What are some advices, food habits that people can have that help people prevent this disease?
So I would like to give my life example that I have been able to avoid diseases, as you know. So I'll tell you what is very, very important for me: exercise and sleep. I really take care of my sleep hygiene in the sense that I make sure that like the curtains are down and like, you know, I have done everything and slept, I mean, proper clothing and everything matters. So the temperature of the air conditioner, etc. So if I haven't slept well, or because of any reason I haven't slept enough, I don't exercise next morning because your immunity is challenged.
Oh, I see.
Yeah. So that is one thing. And exercise is something which is ingrained in us by my dad. So even when we were like 12, 13 years old, even on holidays, we would wake up at 5:36 and do yoga or some kind of exercise. So these two were always a constant in our lives. Secondly, I don't miss my proteins for breakfast, lunch, and dinner. Ever. And I may have lesser carbs and no carbs from one of the meals, but I don't miss my proteins. I always make sure that I'm not having boiled food. I always have some fat in my food. Then I pay attention to my iron levels, B12 and D3. And I do weight training in exercise, either weight training or swimming or floor exercise or physiotherapy. Something goes on a daily basis, or a sport like a paddle. Yeah. So yeah, so exercise is an integral part with the sleep hygiene and having my meals on time. So not only making sure the meals are balanced, but at the same time meals have the timing of my meals, which is if my breakfast is at 9, I have my lunch before 1, and I have my snack before 5, and my dinner before 9. I maintain that gap. If
So the
gap
timings are
yes,
important, very important,
very
always
important.
at the same time.
So to have a good flow of energy,
Oh, I see.
to have not have again low immunity,
Yeah.
and also to stop binging. If the gap is more than 4 hours, there is something called ghrelin, which goes up in your body and your blood, and then you crave for food which you're not supposed to have. Like suppose my gaps are longer, I will have a dessert or will have a something which I'm not supposed to. So that's another thing I take care. And yeah, and a positive mindset, and that is it.
Oh, I love it. In terms of your food habits, what are some of the principles that you follow in terms of your food habits?
Yeah, I like freshly cooked meals.
Okay, yeah.
So my meals always come for lunch. It's always freshly made from 10:30 onwards and delivered to us. That's one thing. Secondly, the curd. I love curd, yogurt. So that's also made really fresh for me. Now in India, I can have those facilities. So it's freshly set in the morning for lunch and freshly set in the afternoon for dinner if I have curd. And of course, after the age of 45, 50, after menopause and menopause, so having a calcium-rich protein is more important at this age because of the loss of calcium because of low estrogen. So that is very important. And I just, God has been kind also on me, maybe. And of course, avoid the obvious, which is alcohol and desserts and frozen desserts. And I literally don't touch fried food, which is especially the commercially available farsan, we call it. Like, I don't have those. And I don't touch papad.
Okay.
Not having papad
Yeah.
is ingrained in me from the age of, like, I wouldn't even allow my younger brothers, sisters to touch it from the time I was 16 years old. Yeah. And aerated drinks, I just don't have.
And packaged foods?
So I don't have them necessarily.
Yeah.
So very seldom if I'm not getting, like,
I see.
I always carry a protein bar if my meals are getting delayed. Like today, because of this podcast, I'll have a protein bar.
Okay. Okay, good. We're coming to the end, and I just would like to ask you, like, what is one thing that you would love people to get out of this conversation? If there's one message.
Yeah. I think that today's generation is really struggling to sleep. So take care of your sleep hygiene. Avoid too much of screen after 11, 10, 10, 10:30. And Keep your phone little away from your body if you can, so that you don't have the first response of picking up the phone, and because that can disturb your. And that's causing a lot of health issues, the sleep hygiene and activity which is not balanced. So maybe sleep you can take.
And the most important, which is the positive attitude.
Yes. Yeah, happiness is the cure for many diseases. Yes.
So good. I love this conversation. I think I think we, and also myself, I feel that is a responsibility for me to amplify voices like you that bring this important information for us that can impact so many lives with something as simple as food. But the most important, as you said, is to know what to do and what to have. So thank you so much for coming.
Yeah, so body is your temple, and nourish it, which will nourish your soul too.
Lovely.
Thank you.